guys, just doing my hemorrhage scenario. So patient here, I'll consider seeing safety, wear appropriate PPE, gain consent from them. Hey mate, I've seen you've got an injury, do you want to have a look in front of the ambulance service? Yes, okay. Alright, so do you mind if I get you in a better position? Brilliant. Sits on your lower leg. Anywhere else? No? Fabulous. Okay, best to lay down, mate, and we'll elevate it so I can have a good look. So elevate the wound. I can see the wound is bleeding. So I have my gloves on, obviously. I would have already washed my hands. Use a sterile gauze, a sterile bandage. Hey mate, I'm just going to put a little bit of pressure. It might hurt a little bit, okay? Your wound's bleeding, so we'll try to stop it. Crepe bandage around over the top of the wound. Assess the PMS of the foot, the distal limb. Penile pulse is there. Fab, or mark it. Can you feel this? Excellent. Cap refill, great. But the wound's still bleeding. The wound's still bleeding, then we get another bandage over top of the wound. Add a little bit of manual pressure. Crepe bandage. Fabulous. Reassess the PMS. Good. Good. The wound continues to bleed, or it's arterial in nature, then this isn't going to cut it. So then we're going to organise a tourniquet. In the meantime, I'm going to include the artery that feeds the limb. So that can either be the femoral artery on the leg or the popliteal, which is a bit closer. So we'll include the popliteal. It hurts a lot, mate. I'm just going to put a lot of pressure behind your knee. I'm just going to save all the blood that's coming out of your leg. Fab. Partner's going to pass me tourniquet. I'll ask partner the time. What time is it, mate? 11:45. Fabulous. 11:45. We're just going to tighten up the tourniquet. It's going to go not over the joint. It's going to go closer to the wound than my occlusion is with my hand, but above the wound, not on the wound. And we're going to tighten up just slowly until the wound stops bleeding. And then we're going to lock it in. Going to mark it 11:45. Correct date. Going to verbalise. Yep, we've got a tourniquet in the left lower leg. I'm going to cut away the pants so it doesn't get covered. I'm going to put a T in this guy's forehead so you can't go wrong. Fabulous. I'm going to reassess that PMS throughout the entire journey. I'll cover this guy in case he gets cold, because he's going to get fluids en route. We'll lift up his other limb on the stretcher. So legs elevated for this gentleman. He transported like that. Warm. 2 cannulas, fluids running, rapid extrication. I think that'll do him.